Okay, thanks. I suppose the challenge for all of us really is how to create that suicide safer community. How to reduce the number of suicides where we live, where we work, where we play. And in order to do that, we must understand a few things. Understand why people consider suicide. Be alert to someone who is struggling and looking for help, and know what sort of help or support people are looking for, or people need. And I suppose to make that happen, the National Office of Suicide Prevention, 2004, they sourced trainings for communities, because they knew that up to then was kind of professionals, that was the area for professionals to deal with. But now it was about bringing it back into communities, having communities responsible for it. So they sourced, the two main trainers they sourced was Safe Talk and ASIST, and they brought them in here in 2004 from it was a Canadian company called Living Works. And Living Works had been providing training since 1983 worldwide. So it's been well researched, these trainings, since back in 1983, and they've been used all over the world. So a little bit about Safe Talk first, and it's a 3.5-hour program, 3.5-hour workshop. And what it does, it prepares people to recognise someone who's having thoughts of suicide and how to link them in with the supports. That's basically what it is. It's about having a conversation about suicide, probably the most difficult conversation we'll have with anyone, but it's a necessary conversation, because think up to this, it was something we couldn't talk about, but now we're saying no, talk about it, get that conversation going. So the conversation starts by telling the person what you've noticed about them, perhaps changes in their behaviour, their self-care or mood and such. And then the next step then, and the very important step, is asking about suicide. Is that how bad things are? And that's part of what we would learn in Safe Talk. And again, it's a really difficult question to ask somebody, but it is, again, a very important one. If it's not asked, we don't get the answer. It's not talked about, and that's part of the difficulty, part of the problem. And also by asking, it gives the person permission to talk about what's really going on for them. What's going wrong in their lives? What's going on? What is their story? And that's what they need to do. So we have to, by asking, we give them permission to do that. By not asking, they don't get permission. And then it's taking time to listen to why suicide, why not, what's going on in their lives, and just taking that time. And that in itself can be hugely therapeutic, just to take that time, put everything aside and listen to why suicide, why now. And finally then is about connecting them with people who can keep them safe. And it's a really important piece as well. But in order to do that, you must know what is available in your own area, what are the supports, what resources. So that's that piece of work we all have to do. What's available in my area? Should I come across somebody who's in difficulties, needs help? Who do I refer them to? Who are the go-to people? The training is suitable for anybody that's interested in the area of suicide, or wishes to become more alert to the issues around suicide. And that'll be from the first responders to community workers, clergy, volunteers, teachers, and people responding to family and friends. So really, it's for anybody, a 3.5-hour workshop. It's well worthwhile. The other program then is ASIST. And the ASIST is much more intensive. It's a 2-day workshop. And it provides you with, it's first aid, suicide first aid is what it is. As I said, it's quite an intensive workshop, but well worth doing for anybody that has done it. And it provides that framework to work with somebody who's having thoughts of suicide. One of the things that stops us from actually asking somebody about suicide is, I don't know what to do. But this teaches you, ASIST will teach you how to work with that, work with the person. So the participants in the workshop, they're challenged in a very safe environment, and they're working interactively with others in small groups, and you get a chance to practice the model that you'll be showing. Certainly a lot of the focus is on how do people look for help when they're having thoughts of suicide, or just going through difficulties. We all have our own ways of looking for help. But somebody that's in that really dark place will have ways of looking for help. And it's how to recognise that. How to recognise somebody that's trying to tell us they're having huge difficulties and they can't say it out straight. For all various reasons, stigma, taboo, all of those sort of things that still exist. So it's being able to identify somebody and recognise somebody that is trying to tell us what's going on for them. It also looks at reasons that prevent people from talking openly about suicide. That says around the stigma, taboo. Let's get it out there. Let's reduce the stigma. Let's reduce the taboo, so that it's easier for people to talk openly and honestly about what's going on for them. To have that open, honest conversation. Even that in itself, just that open, honest conversation, can be extremely therapeutic as well. Now they're getting it out. They're getting it out. They're talking to one other person about what's going on for them. The big part of the workshop is working on a plan to keep the person safe. And that's from the immediate safety for now to the longer term plans. And that's a really important one, because at no stage can we walk away and say, I'm sorry to hear, it's a tough time. We're there. Once we ask somebody, are they thinking of suicide, we have to do something about it. And that's where ASIST will fit in. So again, the training is suitable for people who are in regular contact, perhaps with vulnerable groups, either in the work or in the role within their own community. And just to access the workshops, Yvonne is down at the back there. She represents Breaking Through for this area, for the Kildare, West Dublin, a couple of other areas as well, Yvonne, yeah. Just down the back, Yvonne will tell you a lot more about how to access the workshops, how to join the workshops, but also if you're interested in setting up a workshop in your own area, Yvonne will talk you through that one as well. She will provide all the materials, she'll provide the trainer, she's excellent support. So just down at the back for that. Each area also has a resource officer for suicide prevention linked with the National Office of Suicide Prevention. So if you're looking for to see who is the resource officer in my area, go into nosp.ie and they have the contact details for all of the resource officers in the area. Okay, at this stage I'm going to hand over to Jeff, and Jeff is going to talk about just how it is on the ground and how it actually transfers to community and community works. Jeff.
Thanks, George. Yeah, my name is Jeff O'Toole. I'm from Jobstown. Unfortunately, my area was deemed a suicide black spot for a number of years. It had one of, if not the highest rate of suicide and self-harm in the country. So obviously, as a resident, that doesn't sit well. You want to try to fix something or do something, but we didn't know what to do. So I was speaking with a friend of mine, Frank Stacey, who's a boxing coach up in Jobstown, and he had lost a young lad through suicide, 15-year-old, one of the lads he taught, and it was on his mind that he should have done something. How did I let it get to this? I seen him every day, and I had done the safe talk training through my job as a youth worker, and I'd done the ASIST training too. So I was kind of saying to him, like, how could you have fixed anything? How could you have caught him before then if you're not trained? You're trained to pick up a box, and he was trained how to put a plaster on someone's cut. But there's a lad going there every day, depressed or suicidal and self-harming, and he couldn't see it. So he asked him, I said, look, if we can organise the training, would you do it? And he said he would. So myself and himself, this all happened in the Jobstown pub, so the drinks were flowing, the idea sounded magnificent, they were going to change the world, you know. So the next day we sat down and we came up with a list of all community members. They weren't workers in the community, they were just community members, the football managers, the choir teacher, the drama teacher, the chess coach, the GAA, boxing, kickboxing, taekwondo, anyone who had direct contact with a young person. And we approached them all and said, we're going to organise a training, will you do it? And we contacted Yvonne and we arranged the training for the back room of the Jobstown house. And The pub landlord attended the training, he's trained. George done the training for us in the back of the pub. Great, it went great. But since then, we've had, in 18 months, we've had 6 further groups in the community doing the training. So as of now, there's over 80 members of the Jobstown community trained. None of them are youth workers, none of them are community leaders. They're just, my own mother done the training, Frank's dad is 74, he done the training and used it. But it's a numbers game. Unfortunately, this is how things work. And we didn't realise how, we just hear, when you're in the estate and you hear someone that are dying by suicide, it's starting to become the norm. And this wasn't right. This was kind of, why is this being treated as normal? This isn't normal. So from November 2017 to March 2018, 7 members of Jobstown committed suicide. It's a small area, so the ripples through the whole community. Since we've done the training from March 18 to now, only 1 member of Jobstown has committed suicide. So it's working. You know, it's 1 too many, but to go from 7 in 10 weeks to just 1 in 18 months is a huge improvement. And that's all coming from people like they're going to see now, who have done the training, they're using it. But as George said, there's no point in doing the training and no one knows who has it. It was pointless. No one's going to knock on the door and say, can I talk to you about committing suicide? It doesn't happen. So we made a little video, and I just basically went around with a camera and just stuck it in people's faces on the training. And it was, I'm Jeff O'Toole and it's safe to talk to me. I'm Frank Stacey from Westside Boxing Club. It's safe to talk to me, and so on. And we put it out, and we tried to make it viral. So everybody in the state had seen it. So now they knew, if I'm not feeling the best about wherever, Jeff is already to talk to. Frankie's already to talk to. My Jobstown, the football manager, is already to talk to. John Kilbride in the Jobstown house is already to talk to. And on the back of that, John Kilbride has now made over 20 interventions from the pub. So there was always like a negative connection between mental health and alcohol, and he wanted to get rid of that as well. He didn't want to try just use his position. But he himself has made, because people in the community know now that John is more than a barman, he's made over 20 interventions. He's referred them all. Every one of them have received the help they needed. None of them, touch wood, have self-harmed or even worse, taken their life through suicide. And that is a huge part of just having a conversation with someone who's educated. Like, I was a young fella in Jobstown, I was feeling down. I didn't want to tell my dad about it, because the stigma of the man. I didn't want to tell my school teacher, but I told the football manager, look, I'm not feeling the best today, I don't want to play, I'm down. But he was old school, uneducated. Cop on yourself, come on, get out there and do the job. He wasn't educated. That's wrong. If you're in direct contact with young people in any capacity, you have to have, it's 3 hours. Like, what have you got to do? These are a testament that by doing that for 3 hours, 3.5 hours, and putting yourself available to talk to, and someone who it's safe to talk to, works. So, I'm going to let you see, this was made a year after the original, over a year, say about a year and 3 months, after the original training. And it's just people who've done the training, and if it's worked. I think that. I don't know how I fix my sound here, is it? Okay. I'm Jeff O'Toole, and it's safe to talk to me.
I'm Paul Warren from Jobstown, Celtic. It's safe to talk to me.
I'm Diana O'Brien from Youth Horizons, and it's safe to talk to me.
I'm Jack O'Brien from the Jobstown House, and it's safe to talk to me.
I'm Brendan Matt, Jobstown Celtic. Safe to talk to me.
I'm Frank Stacey from Westside Boxing Club. It's safe to talk to me.
My name is Justine.
Choose suicide. So on a personal level, yeah, it was great, and for a club level, not only I'm a coach in the club, so was my father's on the course as well, and he's in his 70s, and he found it very beneficial. Even to this day, with young kids coming in, the young adults coming in, same conversations, and in the training, you're taught how to approach people, ask the questions, the awkward questions that we felt uncomfortable asking before, where now as we know it's okay to ask these questions.
I found the Safe Talk programme very, very interesting and very helpful. As a community, I suppose, the level of suicides was just phenomenal, and it was affecting nearly every household in one way or another, whether that be through family or friends. And I really felt, as a member of the community, that we needed to do something. So when I heard about the Safe Talk programme, I jumped on it. I thought it was a great idea.
The Safe Talk and the ASIST Training I found really invaluable. Like, I mean, a lot of it is common sense, but there's bits of it in there that would be more like, it's not just what to do, but it's also what not to do, which is probably even more important. There's kind of myths out there, and a common thing where people tell people, be judgmental or kind of put it on them that they're selfish, or don't do this, think about this person or think about that person, and that's probably completely the wrong thing to do. So, from sharing with your peers, and from the way the training is so interactive and kind of discussion based and video based and kind of role plays and all that sort of stuff, it's giving back a few hours of your life that could potentially save somebody else's life.
I have a psychology degree, and think you have a psychology degree so you kind of know a thing or two about how to help people intervene. Safe Talk training really helped me be more forward with actually having the conversation about suicide with members of the community and people I would interact with on a day-by-day basis. Even when I'm seeing for funerals, for example, you're dealing with bereaved families. And a week later, obviously, I always kind of link in with the family and ask them how they're doing. And sometimes, things come up for them and they need a bit of support. And after my training, I'm really able to just be more vocal, more honest in, helping people, using the word suicide more, really.
I actually have. I've actually had to use it quite a lot, and surprisingly, I didn't think I would. I thought maybe, just on a low level.
We have, yeah. I found myself using that at the most random of times, either on the gym floor or somebody, who might have seen the video we put out after the Safe Talk programme was done. Might have come and reach out to me, say, I saw the video that you did after that Safe Talk programme, and we were going to have a chat, and it was nice to just have that little bit of awareness around, that it was okay to move into that space with a person who's been struggling.
I've made a few referrals over the last year, which has surprised me a lot. I didn't think I would have had that much contact, but I have, and it's proved very, very useful.
Yeah, several times. Yeah, not only me, my father as well. We've had a good few. So interventions, a few people let out the counselling, other people just along with chat on them, bit of training. Yeah, so I found the training very beneficial, and we have used it in the gym.
I think every community member should sign up for this. It's absolutely just it's so full of knowledge. Stuff that you've never thought about before. If you're most people who work with people, young people or older people in communities, are generally, they want to help people, they want to you know, they want to be there and offer support if they can. But do you really know how?
I think it's people trying to come in here. I think we struggle with technical difficulties the whole time here.
How to do that. And when you're faced with someone who's really low, suicidal,